Have you ever wondered if that little pill you take every day could be affecting your brain health? Imagine this: you've been taking a medication for years, trusting it's helping you, only to discover it might be harming your cognitive health. Today, we're diving into a topic that affects millions but is rarely discussed: medications that could potentially lead to dementia. Stay with us as we explore 10 common medications linked to cognitive decline. Understanding these risks could change how you manage your health. And make sure you watch until the end, because medication number 8 is the most surprising and widely used. Medication number 1, benzodiazepines. Benzodiazepines such as Xanax and Valium, commonly prescribed for anxiety, insomnia, and stress-related disorders, have been linked to an increased risk of dementia. Medications like diazepam and lorazepam work by enhancing the action of gamma-aminobutyric acid, GABA, a neurotransmitter that produces a calming effect on the nervous system. While effective in the short term, prolonged use can lead to significant cognitive risks. Research indicates that long-term benzodiazepine use may interfere with normal brain function, potentially impairing memory and cognitive processes. For example, a French study involving over 1,000 elderly individuals over 15 years found that regular benzodiazepine users had a 60% higher risk of developing dementia compared to non-users. The physical and psychological dependence that can arise from these medications further complicates matters, making it challenging to discontinue their use without medical supervision. If you or someone you know uses benzodiazepines, discussing the risks with a healthcare professional is crucial. There are alternative therapies, such as cognitive behavioral therapy, CBT, that can effectively treat anxiety and insomnia without the dementia-related risks. Transitioning to these alternatives requires careful planning and monitoring to avoid withdrawal symptoms and ensure treatment success. In light of these findings, it's essential for patients and healthcare providers to critically evaluate the use of benzodiazepines, especially among older adults who are more vulnerable to adverse effects. Considering therapeutic alternatives can safeguard cognitive health while effectively managing anxiety and sleep disorders. Always consult with your healthcare provider before making any changes to your medication regimen to ensure safe and effective treatment. Number 2, anticholinergics. Anticholinergics such as atropine, hyoscyamine, methscopolamine, and scopolamine, a common class of drugs, are often used to treat conditions like allergies, urinary incontinence, and Parkinson's disease. They work by blocking the action of acetylcholine, a neurotransmitter essential for memory and learning. Despite their effectiveness, there's growing concern about their impact on cognitive function. Studies have shown that prolonged use of anticholinergics can lead to cognitive decline, particularly in older adults. Acetylcholine plays a crucial role in brain processes like memory formation and retention. When its action is inhibited, as with anticholinergics, it can lead to memory problems and even increase the risk of dementia. A study conducted by the University of Washington, which followed over 3,400 adults for 7 years, found that individuals who regularly used anticholinergics had a significantly higher risk of developing dementia. Specifically, those taking high doses over long periods were at a 54% increased risk. This is particularly concerning given the widespread use of these medications. Many people might not realize that their regular allergy medicine could contribute to cognitive decline. It's crucial for individuals, especially the elderly, to be informed about these risks. If you or someone you know uses anticholinergics frequently, it's important to have a conversation with your healthcare provider. There are often safer alternatives available. For example, nasal corticosteroids can effectively treat allergies without the cognitive side effects associated with anticholinergics. Number 3, opioid painkillers. Opioid painkillers, such as morphine and oxycodone, are frequently prescribed for severe pain management, especially following surgeries or for chronic conditions. These medications work by binding to specific receptors in the brain and spinal cord, providing effective pain relief. However, they come with potential risks that extend beyond addiction and dependence. Research indicates that prolonged use of opioids can lead to changes in brain structure and function. Studies have shown a reduction in gray matter volume in areas of the brain responsible for memory and decision-making. These alterations can lead to cognitive issues, potentially increasing the risk of dementia over time. The sedative effects of opioids further exacerbate these cognitive challenges, causing drowsiness and difficulty concentrating. One study published in the Annals of Internal Medicine highlighted a significant connection between long-term opioid use and a heightened risk of dementia. This finding underscores the importance of weighing the benefits and risks of opioid therapy, especially for long-term use. So, what can you do if you rely on opioids for pain management? First, it's crucial to have an open dialogue with your healthcare provider. Discuss the potential risks to cognitive health and explore alternative pain management strategies. Non-opioid medications, physical therapy, acupuncture, and mindfulness-based approaches may offer effective relief without the same cognitive risks. If opioids are necessary, work closely with your doctor to use the lowest effective dose for the shortest duration possible. Regular monitoring can help mitigate potential side effects, ensuring your pain is managed while safeguarding your cognitive health. Balancing pain relief with mental clarity is essential for maintaining overall well-being. Number 4. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, such as amitriptyline, nortriptyline are a class of medications primarily used to treat depression, but they also find application in managing other conditions like anxiety disorders, chronic pain, and insomnia. TCAs include drugs such as amitriptyline, nortriptyline, and imipramine, which work by increasing levels of neurotransmitters like serotonin and norepinephrine in the brain. While they can be effective in improving mood and alleviating symptoms of depression, it's important to consider their impact on brain health. One of the concerns with TCAs is their potential cognitive side effects. Some individuals may experience issues such as drowsiness, confusion, and difficulty concentrating. These side effects are more pronounced in older adults, as aging makes the brain more susceptible to medication effects. The anticholinergic properties of TCAs, which can block the action of the neurotransmitter acetylcholine, are partly responsible for these cognitive changes. This blockage can lead to memory impairment and, in some cases, an increased risk of developing dementia. Recent studies have shown a connection between the use of anticholinergic medications, including TCAs, and a higher likelihood of cognitive decline. A study published in JAMA Internal Medicine found that long-term use of these drugs is associated with an increased risk of dementia. This highlights the importance of carefully assessing the need for TCAs, especially in older adults, and exploring alternative treatments where possible. For those currently using TCAs, regular consultations with healthcare providers are essential. Discussing any cognitive changes or concerns with your doctor can lead to adjustments in medication or dosage to minimize side effects. Non-pharmacological treatments, such as cognitive behavioral therapy, CBT, or lifestyle modifications, may also be considered to manage depression effectively while protecting brain health. Number 5. Antipsychotics. Antipsychotics, such as haloperidol and risperidone, are commonly prescribed to manage severe mental health conditions like schizophrenia and bipolar disorder. These medications work by modifying the effects of certain neurotransmitters in the brain, such as dopamine and serotonin, to help control symptoms like hallucinations, delusions, and mood swings. While antipsychotics can be highly effective in managing these severe conditions, prolonged use has been associated with significant risks to cognitive health. Research indicates that long-term use of antipsychotics can lead to cognitive decline and an increased risk of developing dementia. One of the primary concerns is that antipsychotics can cause changes in brain structure and function. Studies have shown that these medications may accelerate cognitive symptoms, including memory loss and impaired thinking. For example, a study published in the British Medical Journal found that elderly patients on long-term antipsychotic therapy had an accelerated decline in cognitive function compared to those not using these medications. Additionally, antipsychotics can cause other severe side effects such as excessive sedation, tremors, weight gain, and diabetes. These side effects can further complicate mental and physical health, making treatment more challenging. For those who need antipsychotics, it is crucial to have thorough medical monitoring. Regular evaluations can help manage side effects and adjust dosages as needed. Number 6. H2 receptor blockers. H2 receptor blockers, also known as H2 antagonists, are medications that reduce stomach acid production. They are commonly used to treat conditions such as gastroesophageal reflux disease, GERD, ulcers, and other digestive disorders. Common H2 blockers include ranitidine, famotidine, cimetidine, and nizatidine. These medications work by blocking histamine receptors in the stomach lining, thereby decreasing acid secretion. While H2 blockers are generally considered safe and effective for managing stomach acid-related issues, there has been some discussion about their potential impact on cognitive health, especially with long-term use. Most people use these medications without significant side effects, but some studies have raised concerns about possible cognitive effects, particularly in older adults. Some research suggests that prolonged use of H2 blockers may be associated with an increased risk of cognitive impairment or dementia in the elderly. However, the evidence is not conclusive, and more studies are needed to determine whether these medications directly cause cognitive decline. Factors such as age, overall health, and the presence of other medical conditions may also play a role in cognitive changes. For individuals concerned about the potential cognitive effects of H2 blockers, it is important to weigh the benefits and risks of these medications. If you rely on H2 blockers for managing acid-related symptoms, talk to your healthcare provider about your concerns. They can help assess your risk and discuss alternative treatment options if necessary. To minimize any potential risks, use the lowest effective dose for the shortest duration possible. Lifestyle changes, such as dietary modifications, weight management, and avoiding triggers like smoking and alcohol, can also help reduce acid-related symptoms without relying solely on medication. Number 7. Antiepileptics. Antiepileptic drugs, such as phenytoin and valproic acid, are crucial for managing seizures in individuals with epilepsy. These medications work by stabilizing electrical activity in the brain, which helps prevent seizures and improves patients' quality of life. However, there are growing concerns about their impact on cognitive health, especially with long-term use. Research shows that prolonged use of antiepileptic medications can negatively affect cognitive functions like memory and concentration. This is because these drugs can interfere with neurotransmitter function in the brain, which is essential for communication between brain cells. Additionally, the sedative effects of many antiepileptic drugs may contribute to drowsiness and difficulty focusing, further exacerbating cognitive issues. A notable study published in Neurology examined the cognitive effects of antiepileptic medications over several years. The research revealed that patients who used these drugs for extended periods had a significantly higher risk of developing dementia. The study highlighted that high doses of these medications were particularly problematic, increasing the risk of cognitive decline. Despite these concerns, antiepileptic medications remain a cornerstone in the treatment of epilepsy. If you are taking these medications, it's crucial to work closely with your healthcare provider to manage potential side effects. Newer treatments and combination therapies may offer options with fewer cognitive risks. Additionally, adjusting the dose of antiepileptic medications can help minimize side effects while maintaining effective seizure control. Number 8. Statins. Statins are a group of medications commonly prescribed to lower cholesterol levels in the blood. High cholesterol is a significant risk factor for heart disease, so statins play a vital role in reducing the risk of heart attacks and strokes. Common statins include atorvastatin, simvastatin, and rosuvastatin. These drugs work by inhibiting an enzyme in the liver called HMG-CoA reductase, which is responsible for producing cholesterol. By lowering cholesterol levels, statins help prevent the buildup of plaque in the arteries, which can lead to blockages and heart disease. While statins are effective at managing cholesterol levels, there are some concerns about their long-term use, particularly regarding cognitive health. Studies have suggested that statins might impact memory and cognitive function. For example, some research indicates that statins could be linked to mild memory problems in some individuals, although this is not a universal experience. A study published in the Journal of the American College of Cardiology examined the cognitive effects of statins and found that while some patients reported minor memory issues, these were generally not severe or long-lasting. The benefits of reducing heart disease risk often outweigh these potential side effects. However, if you experience noticeable changes in memory or cognitive function while on statins, it is important to discuss these concerns with your healthcare provider. Number 9. Proton pump inhibitors, PPIs. Have you ever used proton pump inhibitors, or PPIs, to ease stomach problems like acid reflux or ulcers? While these medications can provide significant relief, they may also have hidden risks, particularly concerning cognitive health. PPIs, such as omeprazole and esomeprazole, are commonly prescribed to reduce stomach acid production. They work by blocking the proton pumps in the stomach lining that produce acid. This can help alleviate symptoms of heartburn and prevent damage to the gastrointestinal tract. For many people, PPIs are an effective solution for managing these conditions. However, recent research suggests that long-term use of PPIs may come with potential drawbacks for brain health. Studies have indicated that extended use of PPIs could be linked to cognitive decline and an increased risk of dementia. One reason for this connection is that reducing stomach acid can impair the absorption of essential nutrients needed for brain function, such as vitamin B12 and magnesium. These nutrients are crucial for maintaining cognitive health, and their deficiency might contribute to memory problems and other cognitive issues. Additionally, some research suggests that PPIs might directly affect brain function, although the exact mechanisms are still under investigation. A study published in the Journal of the American Geriatrics Society followed over 1,000 elderly patients and found that those who used PPIs regularly had a higher risk of developing dementia compared to those who did not use these medications. If you rely on PPIs for managing your stomach issues, it's important to discuss these potential risks with your doctor. They might suggest alternative treatments, such as lifestyle changes, dietary adjustments, or less potent antacids, which could provide relief without the same cognitive risks. Number 10. Hormonal contraceptives. These popular medications, especially those that combine estrogen and progesterone, are commonly used to prevent pregnancy and manage various conditions like menstrual irregularities and acne. However, recent research suggests that they might have an impact on cognitive function. Hormonal contraceptives work by altering hormone levels in the body to prevent ovulation and regulate the menstrual cycle. Estrogen and progesterone, the key hormones involved, play significant roles in many bodily functions, including brain health. These hormones are essential for maintaining cognitive functions such as memory, learning, and mood regulation. When their levels are artificially modified over extended periods, it may lead to unexpected effects on the brain. Studies have raised concerns about the potential link between long-term use of hormonal contraceptives and cognitive decline. For instance, research published in the Journal of Women's Health followed women who used hormonal contraceptives for many years. The study found a slight decrease in cognitive function among these women compared to those who did not use such medications. While the exact mechanisms behind this are still being studied, it's believed that altering the natural levels of sex hormones can impact brain function. It's important to note that while these findings are concerning, they are not yet definitive. the relationship between hormonal contraceptives and cognitive health needs further research to fully understand the risks involved. If you are using hormonal contraceptives and have concerns about their impact on your brain health, it's wise to discuss them with your healthcare provider. They can help you weigh the benefits and potential risks and explore alternative options if needed. Did you know that over 11% of people aged 65 and older are living with Alzheimer's disease, the most common form of dementia? That's millions of individuals and families affected by this progressive brain disorder. Imagine suddenly struggling to remember simple things, like where you parked your car or how to get home from a familiar place. These seemingly minor lapses can be early warning signs of a much larger issue. Today, we're delving into the 12 early signs of Alzheimer's disease that everyone should be aware of. Understanding these signs and taking action early can make a significant difference. So, let's uncover these warning signs and learn how to protect your brain health for the future. Number 1. Loss of navigation. Have you ever found yourself disoriented in a familiar place or forgotten where you parked your car? This disconcerting experience could be more than just a momentary lapse. Loss of navigation is often one of the earliest signs of Alzheimer's disease. This symptom is linked to the shrinking of the parietal lobe, a part of the brain crucial for spatial memory and navigation. The parietal lobe helps us process spatial information and orient ourselves in our environment. When it begins to shrink due to Alzheimer's, this ability deteriorates. You might start to notice difficulty in remembering how you arrived at a location or in retracing your steps. Even familiar routes, like the way home from the grocery store or your usual path through a park, can become confusing. In the early stages, these navigation issues might seem minor or be easily attributed to stress or distraction. However, if they become more frequent and severe, it's important to pay attention. Losing your way in familiar settings or frequently forgetting where you parked can disrupt daily life and cause significant stress. While occasional forgetfulness can be normal, consistent problems with navigation should not be ignored. If you or someone you know experiences these symptoms, it's crucial to consult a healthcare professional for a thorough evaluation. Early detection and intervention can make a significant difference in managing Alzheimer's disease. 2. Judging distances. Struggling with depth perception or finding it difficult to judge distances accurately can be another early sign of Alzheimer's disease. This issue arises as some brain cells start to starve for glucose, affecting your ability to process visual and spatial information. For example, you might find it challenging to walk upstairs, park your car, or recognize 3D objects correctly. Tasks that require accurate judgment of distance, such as pouring a drink without spilling or reaching for an object, may become increasingly difficult. Vision problems associated with Alzheimer's can lead to frequent tripping, bumping into objects, or difficulty in navigating spaces that were once familiar. These difficulties are more pronounced than the typical vision changes associated with aging and can significantly impact daily activities. 3. Repeating yourself. Do you find yourself repeating the same stories or questions within a short period? This could be an early warning sign of Alzheimer's disease. Repeating yourself frequently occurs when the brain struggles to form new memories and connections. In Alzheimer's disease, the neurons in your brain have difficulty making new connections due to the buildup of amyloid plaques and other changes. This disruption means that recent conversations or events don't get stored properly in your memory. As a result, you might find yourself asking the same question multiple times or retelling a story you've already shared, without realizing you've done so. Family members and friends are often the first to notice this pattern. They might point out that you've already mentioned something or asked a question. While occasional repetition is normal, especially during stressful or busy times, consistent and frequent repetition is not. For instance, you might tell a friend about a recent trip, only to bring it up again a few minutes later as if you hadn't mentioned it before. This can be frustrating for both you and your loved ones, and it can indicate that your brain is having trouble processing and retaining new information. 4. Losing things. Misplacing items occasionally is normal, but consistently losing things and being unable to retrace your steps can be an early sign of Alzheimer's disease. This symptom is more than just common forgetfulness, it's an indication that the brain's ability to form and recall memories is deteriorating. When you have Alzheimer's, the connections between your neurons weaken and break down, making it difficult to remember where you placed everyday items. You might frequently lose keys, glasses, or important documents and struggle to remember where you last had them. Unlike typical forgetfulness, where you can usually backtrack and find the missing item, Alzheimer's makes it challenging to reconstruct your actions. For example, you might put your wallet in an unusual place, like the refrigerator, and have no recollection of doing so. Even more concerning, you might start accusing others of stealing your belongings because you genuinely cannot remember where you left them. This can lead to frustration and anxiety, both for you and those around you. 5. Memory aids. Using memory aids like sticky notes, reminders, or digital alerts is common and often helpful. However, an increasing reliance on these aids can be an early indicator of Alzheimer's disease. When your brain starts to struggle with forming new memories due to Alzheimer's, you may find yourself needing to use these tools more frequently to keep track of everyday tasks and important information. People in the early stages of Alzheimer's might cover their homes with sticky notes to remember simple tasks such as taking medication, locking the doors, or even turning off the stove. Digital reminders on phones or tablets might become essential for recalling appointments, birthdays, or other significant events. While these aids can be beneficial, a growing dependence on them could signal that your brain's natural memory functions are declining. For instance, you might find that without a sticky note, you forget to attend a scheduled meeting or buy essential groceries. You may start to create complex systems of reminders to manage daily life, and despite these efforts, still feel confused or overwhelmed. This reliance can be frustrating and worrisome, as it disrupts your normal routine and reduces your confidence in your memory. 6. Confusion. Experiencing frequent confusion about time, place, or people can be another early sign of Alzheimer's disease. This type of disorientation goes beyond occasional forgetfulness and can significantly impact daily life. As Alzheimer's progresses, it disrupts the brain's ability to process and store new information, leading to moments of bewilderment and uncertainty. Individuals with early Alzheimer's might confuse the time of day, often thinking it's morning when it's actually evening. They may forget where they are, how they got there, or why they are there in the first place. This confusion can be particularly pronounced in new or unfamiliar environments, but it can also occur in places they have known for years. For example, someone might leave the house thinking they are going to work, even though they retired years ago. This disorientation can also extend to people. Alzheimer's patients may not recognize familiar faces or might confuse people's identities. They could mistake a grandchild for their own child or believe they are in a different stage of life. This can lead to telling stories from the past as if they are happening in the present, further illustrating their disconnection from the current reality. 7. Speaking problems. Struggling to find the right words or having difficulty following a conversation can be an early sign of Alzheimer's disease. As Alzheimer's progresses, it can disrupt the brain's language centers, making it hard to communicate effectively. This goes beyond occasional lapses in conversation and can significantly affect day-to-day interactions. People with early Alzheimer's might frequently pause during conversations, searching for the right words to express themselves. They might describe an object or a concept indirectly because they can't recall its specific name, saying that thing you used to cook instead of stove, for example. This can make their speech seem disjointed and confusing to listeners. Following a conversation can also become challenging. Individuals might lose track of what was being said, ask repetitive questions, or respond inappropriately because they misunderstood a previous part of the discussion. This can be frustrating for both the speaker and the listener, leading to social withdrawal and communication barriers. Additionally, individuals with Alzheimer's might find it difficult to join in group discussions. They may have trouble keeping up with the flow of conversation or contributing relevant comments, causing them to feel isolated or embarrassed. 8. Problem solving. Experiencing difficulties with problem solving and planning everyday activities can be an early warning sign of Alzheimer's disease. This symptom goes beyond occasional errors and indicates a deeper disruption in cognitive functions that are essential for managing daily tasks. Individuals with early Alzheimer's might struggle to follow familiar procedures, such as following a recipe they've cooked for years. They might find it challenging to manage their finances, forgetting to pay bills or miscalculating expenses. These issues arise because Alzheimer's affects the brain's executive functions, which are crucial for organizing, planning, and carrying out complex tasks. For example, someone might forget the steps needed to prepare a meal, starting but not finishing cooking processes, or leaving out essential ingredients. They may also have trouble organizing their day, forgetting appointments or mixing up the order of tasks, like putting on clothes in an incorrect sequence. This decline in problem-solving skills can extend to more basic activities. They might find it hard to solve simple puzzles or navigate routine decisions, leading to frustration and a sense of helplessness. 9. New memory issues. One of the hallmark signs of early Alzheimer's disease is difficulty forming new memories. While everyone experiences occasional forgetfulness, Alzheimer's patients consistently struggle to remember recent events, conversations, or new information. This impairment goes beyond normal age-related memory lapses and indicates a deeper issue within the brain's ability to process and store new memories. For instance, someone with early Alzheimer's may have trouble remembering what they had for breakfast, even if it was just a few hours ago. They might repeat questions or stories because they don't recall that they've already asked or told them. This repetitive behavior is frustrating for both the individual and their loved ones. Additionally, new memory issues can manifest in forgetting appointments, important dates, or the names of new acquaintances. While they may still recall events from the distant past, their short-term memory becomes increasingly unreliable. This discrepancy occurs because Alzheimer's affects the brain's ability to create new connections, leading to a gradual decline in the retention of recent information. 10. Social withdrawal. Social withdrawal can be a significant early sign of Alzheimer's disease, impacting how individuals interact with others and participate in social activities. As Alzheimer's progresses, individuals may gradually withdraw from social engagements, hobbies, and interactions they once enjoyed. This withdrawal is often due to feelings of embarrassment, confusion, or discomfort stemming from cognitive decline. For example, someone with early Alzheimer's may start to avoid social gatherings or conversations because they struggle to follow the flow of discussion or remember names and faces. They may feel anxious or self-conscious about their memory lapses, leading them to isolate themselves to avoid embarrassment. This withdrawal can also stem from difficulty in maintaining meaningful conversations or engaging in activities they used to find enjoyable. Family members and friends may notice this change as the individual becomes less interested in socializing or participating in group activities. They may prefer solitude or familiar environments where they feel less vulnerable or overwhelmed by cognitive challenges. 11. Changes to personality. Alzheimer's disease can lead to noticeable changes in a person's personality, often affecting their mood, behavior, and emotional responses. These changes can be unsettling for both the individual and their loved ones, as they may differ significantly from the person's usual temperament and habits. As Alzheimer's progresses, individuals may become more irritable, anxious, or easily agitated, even in familiar situations. They may display heightened levels of suspicion or paranoia, believing that others are plotting against them or stealing from them. Conversely, some individuals may become apathetic or withdrawn, losing interest in activities they once enjoyed. Changes in personality can also manifest as increased impulsivity or disinhibition, leading to socially inappropriate behaviors. For example, someone who was previously reserved may now make tactless comments or exhibit inappropriate sexual behavior. These changes occur because Alzheimer's affects the brain's frontal lobe, which regulates emotions, impulses, and social behavior. 12. Misidentification. Misidentification is a troubling early sign of Alzheimer's disease where individuals begin to confuse people, places, or objects. This can lead to disorientation and emotional distress. For example, someone with Alzheimer's might mistake a close family member, like their son, for another person, such as their spouse. They may also misidentify everyday objects, believing a TV remote is a phone or a stranger in the mirror is an intruder. These misidentifications occur because Alzheimer's affects the brain regions responsible for recognition and memory. As the disease progresses, it becomes increasingly difficult for the brain to process and correctly interpret visual and contextual information. Misidentification can be particularly challenging for caregivers, who may find these episodes distressing or hard to manage. What can you do to protect your brain? If you're concerned about Alzheimer's, there are proactive steps you can take. 1. Avoid sugary and refined foods. Cut out sugary foods, refined carbs, and alcohol. Replace them with healthy fats like extra virgin olive oil, avocado, and raw coconut oil to prevent damage to blood vessels in the brain. 2. Exercise regularly. Engage in activities like jogging or swimming for at least 30 minutes, twice a week. Exercise boosts blood flow, delivering oxygen and glucose to your brain cells, preventing shrinkage. 3. Nutrient-dense foods. Eat foods like garlic, parsley, radishes, Brussels sprouts, bone broth, turmeric, sauerkraut, beet tops, milk thistle, and cruciferous vegetables. These help dissolve amyloid plaques and protect your brain cells. 4. Load up on DHA-rich foods. Consume foods rich in DHA, such as pasture-raised eggs, shellfish, beef liver, and oily fish like salmon, sardines, and mackerel. DHA helps prevent hippocampus shrinkage, crucial for memory and learning. Taking these steps can supply your brain with the nutrients it needs, potentially reducing the risk of Alzheimer's from an early age. It's never too early or too late to start taking care of your brain. Recognizing the early signs of Alzheimer's can be life-changing, allowing for early intervention and better management of the disease. If you or a loved one are experiencing any of these symptoms, it's crucial to consult with a healthcare professional for a proper diagnosis and personalized advice. Do you often feel exhausted despite getting enough sleep? Have you noticed difficulty remembering recent events or trouble finding the right words? Are you constantly fidgeting or feeling restless? These common issues might indicate that your brain needs some extra attention and care. In this video, we will explore signs of potential brain health problems and share practical steps you can take to improve your cognitive well-being. By understanding these symptoms and making targeted lifestyle changes, you can enhance your brain's health and overall quality of life. Number 1. Waking up too often. Frequent awakenings during the night can disrupt your sleep cycle, affecting both your brain and overall health. If you find yourself waking up regularly, it might be due to stress and anxiety, which can cause your body to produce high levels of cortisol, a hormone linked to stress. Elevated cortisol levels disrupt your sleep and can cause the hippocampus, a part of the brain crucial for memory and emotional regulation, to shrink over time. Deep, restorative sleep is essential for balancing stress hormones and allowing your brain to repair itself. When you lack adequate sleep, your brain struggles to function optimally, leading to problems with concentration, mood, and memory. Over time, this can increase your risk of developing more serious issues like depression and anxiety. 2. Brain fog. Brain fog is a term used to describe feelings of confusion, forgetfulness, and lack of focus. If you struggle to concentrate and think clearly, especially in the mornings, it might be due to several factors affecting your brain's health. Low blood flow, high stress, lack of sleep, or insulin resistance can cause parts of the brain to shrink, leading to cognitive difficulties. Eating too much sugar and refined carbohydrates can also contribute to brain fog. These foods cause your brain cells to resist insulin, a hormone that helps cells absorb glucose, their primary source of energy. When brain cells are starved of energy, it becomes difficult to form connections and think clearly. 3. Recurrent headaches. Occasional headaches are normal, often due to factors like lack of sleep or dehydration. However, if you experience headaches more than 10 times a month, it could be a warning sign of underlying brain health issues. Frequent headaches can indicate insufficient blood flow and oxygen supply to the brain, affecting its performance. These headaches might be related to conditions such as high or low blood pressure or anemia, where a low red blood cell count reduces oxygen delivery to the brain. As a result, you may struggle with concentration, irritability, and fatigue. To manage frequent headaches, adopt healthy habits like staying hydrated, maintaining regular exercise, and eating a balanced diet rich in essential nutrients to improve blood circulation and prevent anemia. It's crucial to pay attention to these symptoms and consult a healthcare professional for a proper diagnosis and treatment plan. 4. Mood swings. Have you ever noticed feeling perfectly fine one moment and then suddenly becoming anxious, irritable, or upset without any clear reason? Frequent mood swings like these can indicate imbalances in your brain's health. One potential cause is fluctuations in blood sugar levels, which can deprive your brain cells of the fuel and oxygen they need to function properly. Additionally, a compromised blood-brain barrier might allow toxins to enter your brain, increasing your sensitivity to stress and emotional changes. These issues can make your emotions feel like they're constantly on a roller coaster, affecting your daily life and relationships. 5. Depression. Depression often stems from prolonged exposure to stress, anxiety, and unresolved fears, which can throw your brain's chemistry out of balance. When the levels of crucial neurotransmitters like dopamine, serotonin, and acetylcholine become disrupted, you might feel drained of motivation and energy, experiencing persistent sadness and fatigue. Inflammation in the brain is another common factor associated with depression. It can exacerbate feelings of hopelessness and lead to cognitive difficulties, such as trouble concentrating and making decisions. This emotional and mental strain can make it hard to enjoy daily activities and maintain relationships. 6. Dizziness. Frequent dizziness can be unsettling and may indicate a lack of proper blood flow to your brain. When your brain doesn't receive enough oxygen, you can experience sensations of lightheadedness or imbalance. This problem is often linked to deficiencies in essential nutrients such as vitamin B12 or iron, both of which are crucial for producing healthy red blood cells that transport oxygen throughout the body. If your red blood cells are enlarged due to low levels of these nutrients, they may not effectively carry oxygen, leading to symptoms like dizziness. This issue is more common in individuals who follow restrictive diets or have absorption issues, leading to deficiencies. 7. Anxiety. Anxiety can manifest as persistent worry, fear of the unknown, and an inability to relax, often overwhelming the mind. When your brain is stuck in fight or flight mode, it can cause feelings of unease and tension. This response is often linked to an overactive amygdala, a part of the brain responsible for processing emotions and stress. Additionally, factors such as stress, poor sleep, and nutrient deficiencies can exacerbate anxiety, disrupting neurotransmitter balance and heightening your emotional response. Chronic anxiety can also lead to physical symptoms, including a racing heart, sweating, and trouble sleeping, further affecting your quality of life. 8. Slow learning. If you find it difficult to absorb new information quickly or struggle to connect ideas, it might indicate a slowdown in your brain's ability to process and transmit nerve impulses. This can often be linked to a deficiency in acetylcholine, an important neurotransmitter involved in learning and memory. Additionally, insulin resistance in the brain can impact its energy supply, making learning and cognitive functions sluggish. When your brain cells can't efficiently use glucose for energy, it becomes harder to focus and retain new information. This issue is particularly prevalent in those who consume high amounts of sugar and refined carbohydrates, leading to reduced brain function. 9. Restlessness. Feeling constantly restless, with a need to move or fidget, can be a sign of an imbalance in your brain's chemistry. This urge to move might stem from high levels of cortisol, the stress hormone, or imbalances in neurotransmitters like dopamine and norepinephrine, which are crucial for regulating attention and activity. Restlessness is often seen in individuals with attention deficit disorders, such as ADD or ADHD. It can lead to difficulty concentrating, irritability, and an inability to relax or sit still, impacting daily life and productivity. 10. Language problems. Struggling to find the right words or having difficulty understanding spoken or written language can be an early sign of brain health issues. This may occur when areas of the brain responsible for language processing and production are affected, often due to reduced blood flow or loss of brain cells. While some cognitive decline is expected with aging, significant language difficulties can happen earlier in individuals with unhealthy brains. Factors such as high stress levels, poor nutrition, and lack of mental stimulation can accelerate this decline. Deficiencies in nutrients like omega-3 fatty acids, which support brain cell membranes, can impact communication between neurons, affecting language skills. 11. Short-term memory loss. Experiencing short-term memory loss, such as forgetting recent conversations or misplacing items, can indicate issues with brain health. The hippocampus, a region of the brain crucial for forming new memories, can shrink due to various factors, leading to difficulties in retaining new information. Common causes of short-term memory loss include stress, poor sleep, and nutritional deficiencies. High levels of stress and cortisol can interfere with the brain's ability to store memories. Additionally, insufficient sleep disrupts the brain's processes for consolidating new information. A lack of essential nutrients, particularly B vitamins and omega-3 fatty acids, can also impair memory function. 12. Constant fatigue. Feeling tired all the time, even after a full night's sleep, can be a sign of chronic fatigue syndrome or other underlying brain health issues. This persistent fatigue often occurs when the brain is not getting the nutrients it needs or is overworked due to stress and hormonal imbalances. Factors such as poor diet, lack of physical activity, and high stress levels can contribute to constant fatigue. When the brain lacks essential nutrients, its energy production is compromised, leading to feelings of exhaustion. Chronic stress can exacerbate this by disrupting sleep patterns and hormonal balance, further draining energy levels. If you experience these symptoms and want to improve brain health, there are steps you can take to multiply brain cells and enhance neuron connections. Aerobic exercise. Regular aerobic exercise is the best way to boost brain cell numbers and prevent brain shrinkage with age. Exercise promotes growth factors that help form new blood vessels and grow new brain cells. Brain training. Encourage your brain to form new connections by learning new skills, solving puzzles, and reading. This boosts neuroplasticity, reviving parts of the brain that may have shrunk. Seafood. Eat oily fish rich in DHA and EPA, like sardines, salmon, and mackerel. These provide materials needed to repair brain tissue and build new neurons. Sleep. Get 7 to 9 hours of quality sleep to balance cortisol and repair brain cells. If needed, try supplements like tryptophan or magnesium for better sleep. Fasting. Eat 2 meals a day within a 6-hour window, drinking only water outside this time. Intermittent fasting stimulates growth factors that create new brain cells and makes cells more insulin sensitive, helping brain energy. Sunlight. Expose your skin to sunlight to increase vitamin D and melatonin, hormones that protect against brain diseases and reduce inflammation. Avoid vegetable oils. Stay away from foods cooked in unstable vegetable oils, which oxidize and harm brain cells. Use stable fats like coconut oil or grass-fed butter. Low carb. Follow a low-carb diet like keto, reducing carbs to under 50 grams a day. This cuts neuroinflammation and improves memory, concentration, and sleep. Choline. Eat foods rich in choline, like egg yolks, organ meats, and blueberries. Choline helps create acetylcholine, essential for brain function. Magnesium L-threonate. For stress, anxiety, or sleep issues, take magnesium L-threonate, which crosses the blood-brain barrier. Aim for 3,000 milligrams per day to enhance learning and grow new neurons. Taking care of your brain is crucial for maintaining overall well-being. Remember, small steps can lead to significant improvements. If any symptoms persist, consult a healthcare professional for personalized advice. Thank you for watching, and don't forget to subscribe for more insights on maintaining a healthy lifestyle.